We have more for your ears only. I'm Catherine Herzog.
I'm David Alpern with this quote from the news. Maybe you don't want to pay the cost, but you can't say there's no benefit. That was Dr. Janet Curry of Princeton's Center for Health and Well-Being on research indicating that expanding Medicaid saves lives. Another study suggested that the Supreme Court decision allowing states to opt out of Medicaid expansion without penalty will lower federal costs because 3 million people will not end up with coverage. Now this.
Now, what would an AIDS conference be without a little protesting? We understand that. Part of the reason we've come as far as we have is because so many people all over the world have not been satisfied that we have done enough.
And what would an AIDS conference be without the vision, as expressed moments later by Secretary of State Hillary Clinton in Washington last week, of a world finally free of a disease sustained for so long by ignorance, prejudice, and roadblocks, both scientific and economic. But this year, the vision has more realistic prospects than ever, thanks to new tests, treatments, and studies that show significant prevention is possible, even before there is an effective vaccine or final cure.
To recap the 2012 World AIDS Conference in Washington for your ears only, we're joined again by Matthew Kavanagh, Director of U.S. Advocacy at Health Gap, or Global Access Project, that pushes for greater resources, lower costs, and more widespread availability of AIDS treatment worldwide. Welcome back to our program.
Thanks for having me.
What are the latest basic figures on the number of people with AIDS in the U.S. and worldwide and the rate at which the disease continues to spread in various places?
So there's 34 million people living with HIV around the world, and last year just under 2 million new infections happened worldwide. You've got new infections happening in the United States, but also increasingly in subsets of the population. And so especially folks like men who have sex with men, women of color, others are really seeing increasing rates. But the good news is that we've seen a leveling off of the AIDS pandemic, a leveling off of deaths. And all the modeling is showing us that if we can take specific action, we can actually see dramatic downturns all across the board.
Even before the conference, there were some significant steps in the AIDS war this year, including a Food and Drug Administration okay for home-use AIDS tests. Talk about the role you see these tests playing in the U.S., where 20% of those infected still don't know it.
That's right. And I think the critical thing that we've reached is that we're talking now about strategies like test and treat, in which if we can actually find every person who's living with HIV, or at least a substantial portion of them, we're talking about a world in which we can get people access to the drugs they need, to the prevention technologies that they need, and that's actually going to be able to turn everything around. Here in the U.S., one of the things that we know is that we've reached the easiest folks to reach. So it's those people who aren't coming into clinics, who aren't getting tested by their doctors, that have to get access. And it's really helpful to actually have a home test in which people can go ahead and do that. Because if we don't identify the remaining 20% of folks, we won't actually be able to end the pandemic. And that's going to be a critical piece for the next few years.
What about the earlier fear that a positive result with a home test with no health professional around for guidance could be too difficult for an individual to deal with?
It's still a worry. And this is why, we think that there's a ton of pushing that needs to happen at the provider level, right? And so making sure that people's doctors are actually asking them, ideally all the time, have you had an HIV test? Would you like one today? Every single time they have a visit, because that's a great opportunity for them to be with a medical professional to do that. That said, at this point, we've come a long way in stigma, we've come a long way in the treatment, we've come a long way in the fight against HIV, and that means that at this point, the biggest barrier is getting people to know their status and being able to actually get them access to services. And if for some people, that home test is going to be that barrier and that's what's going to get them past it, then it's probably worthwhile.
There was also approval for use of an AIDS treatment called, I believe, Truvada, to prevent healthy people from contracting the disease. How does that differ from a vaccine?
It's very interesting. What it is it's the same antiretroviral that folks take to actually stay alive, stay healthy, who are HIV positive. And the idea is that people who are at very high risk of HIV could take those similar drugs beforehand, and there's actually been a showing that they have preventive benefit. Now, it's a little bit complicated and it's a little bit complex to understand how to implement this. you don't have a 100% effectiveness rate. And so there's a real worry that, in fact, we have to be careful about saying this is a vaccine. Vaccines people think about as something that you take and then you don't have to worry about getting measles, mumps, right? And for HIV, you've got situations where people are actually taking risks based on what their perceived understanding of how likely they are to get HIV. So there's a real worry that we understand this for what it is. It's somewhat effective for a subset of population and for people that are at high risk, whether that be people who are involved in commercial sex work, people who are in high-risk subgroups in the United States, or for people like young women in certain communities around the world. It could be that ensuring this extra added prevention could actually stop the virus for them, and that might make sense.
One highlight of the conference was new evidence that treatments for those who already have AIDS can lower the levels of the virus they carry to the point that they do not spread the disease, saving both lives and more money than the treatments themselves cost. What are the implications for AIDS policies in the U.S. and worldwide and the resources they'll require?
So this is the real game changer from the conference. The HPTN 052 study showed that HIV prevention can happen from taking HIV medicines, right? That it lowers the viral load so much that the patient is actually 96% less likely to transmit HIV to their partner. That's a complete game changer. That's like the level of condoms when it comes to effectiveness. So then the question is it good for people, right? Because you don't want people to be initiating medicines before it's good for them. And the really helpful finding out of this conference was that, in fact, starting earlier, starting even as soon as you're diagnosed, might make a lot of sense for patients because it drives people's immune system up. And it actually prevents things like tuberculosis around the world. It prevents hepatitis C. It prevents all sorts of other opportunistic infections from actually setting in, meaning people don't get sick and they stay alive. That's an incredible finding. And it means that for us, we need to be talking no longer about a situation of let's find the sickest people and put them on AIDS drugs. But actually, if we can figure out a strategy to get everybody who's HIV positive who wants to be on treatment, that's going to be a critical part because it's going to drive down new infections, make death nearly impossible from HIV, and mean that there's actually an end of the pandemic in sight. It does mean, though, that we're going to need some more money.
Matthew Kavanagh is Director of U.S. Advocacy at HealthGap, the global access project for HIV/AIDS.
Quote from the news, "It is one extra kick in the stomach." That was an economist at IHS Consulting on the impact of high food prices caused by current drought on low-income families. Extreme weather is also predicted to cause costly damage to U.S. infrastructure.
Next, the student debt bomb, for your ears only.